Just one of several wildfires that have blazed across central Texas in the last couple of weeks. And even if you live nowhere near them, they can have a big impact on your health. I spoke with a doctor with the American Heart Association to learn how.
Joining me today is Dr. Matt Ashely, who serves on the board of directors for the American Heart Association and is the chief medical officer at the Center for Neuroskills. Dr. Ashely, let's first start with wildfires, because unfortunately, we're in the thick of it when it comes this season. We've had our fair share of wildfires so far. Are there certain health impacts that we need to be watching for as the general public when it comes to more specifically that wildfire smoke?
Yeah, Kristen, I think that people who are in sensitive groups, whether that relates to cardiovascular disease, respiratory disease, or brain health, need to be paying attention to the effects that wildfire smoke can have on them. And there are several ways, fortunately, that they can protect themselves.
Dr. Ashely, why is it that people who have that cardiovascular disease or heart and lung disease that they're more susceptible than the average person?
When they inhale the particulate matter that is problematic in wildfire smoke and other forms of air pollution, they're more predisposed to developing difficulties with acute events. For example, acute heart attack in response to that stress on their system. Long-term air pollution of any kind is problematic for all individuals and is something that everybody should be aware of and concerned about. But people who have known or existing respiratory, cardiovascular, or brain health issues should really have an elevated bar for being concerned about that in the short term, meaning days and weeks.
Are there things that they need to be doing to better protect themselves?
One is being aware of the problem and being aware of the current conditions that are around them. So there are many resources available online to be able to check the air quality on a daily and weekly basis. People who are sensitive or in sensitive groups should be monitoring that for themselves and really limiting their outdoor time in situations where the air quality is poor. They can also protect themselves in their indoor environments by using high quality air filters and limiting the effect of outside air in those settings. And if they do really need to spend significant time outdoors in situations where the air quality is poor, they can use a mask, a high quality mask to help to filter out some of those particles.
Dr. Matt Ashely, thank you so much for joining us today.
Pleasure, Kristen. Thanks for having me.